In the MicroMD EMR, using a form encounter, I want to demonstrate your Georgia Workcomp form. So I click New Encounter for my patient and choose my form. You can see them in a favorites list. In this case, I have 2 copies. I'm going to use the advanced copy and just say OK to load my form on screen. The form, as you can see, has been created to mimic or look as much like your current Georgia Workcomp form. Here is the current view of your Georgia Workcomp form, including the bottom signature section. And here is the EMR view of the same form, including the signature section. As you can see, it's pulling the digital signature, which is done by mouse. Someone using a tablet can obviously create a better looking signature. Anyhow, the fields have been created to be checkboxes so you can quickly come through and check and use drop downs or calendars for dates to enter your dates for date of injury, etc. And the date the disability began, I'm just going to pick days. You can certainly determine which treatment. It's automatically going to pull my provider, so if I'm wanting that provider to populate, I can go ahead and do that. Patient's history. This field is a text field. Of course, if you printed, you could populate that way, and you have 4 rows of text that you can populate, I believe, or 3. Same with findings. Text field. Text field. Text field. Again, you can print and just write on them, or you can use it electronically. More calendar drop downs, as well as estimate length of disability, so I could say 5 months, years, weeks, whatever I want. Asking if it's catastrophic case management, yes or no answer. You could leave it blank, or you can choose a yes or no answer. We can change that drop down to be whatever you want it to be. More calendars. More calendars here for the dates here with restrictions. And if we were to choose the patient was going back today with restrictions, I would then type in this text field next to what the restrictions are, no bending, whatever the case is. Hospital info, you would type in here. You have 2 rows of text where you could put a hospital name and address. So you want to have, does he have permanent disability? We could choose that. Specify the part of the body, knee, left. And I can give the AMA percentage by choosing my percentage from this drop down here. So I could do them at 7% disability. Data service, you can populate here. We can modify how this looks where you only have a single date. We could also bring in codes here into this section if you want to get a little more advanced with the form. I did not populate all the data within here for these checkboxes, but I started to. You can see where I could check them off and just build in the rest of the form there, as well as printing, allowing the patient to sign, or if you have a tablet PC, the patient could digitally sign here, mark the date and using the calendar, key in the time. And we can also in here have a drop down for the nurse, or we can just type our name as the nurse. It's automatically going to pull the signature. I can check yes or no for whether or not it was dictated. I wanted to come back up here and just show you it's pre-populating all my patient information, including phone number, social security, and employer information. I use the unique setup because we don't have employer fields built in. However, we have school, so we can utilize school to be employer in this case, and I can find out about updates. That way it's auto-pulling the information regarding the employer, as well as it can pull the insured name. You will have to key in the address, phone number, etc. for this. So that's going to bring me into my bill builder screen. So we could capture that, we could advance this form where we're capturing the diagnosis and procedure codes while we're doing that form, and have a second page that allowed you to get some meaningful use measures if you're trying to track those as well. And you could just print page 1 off for Workcomp to send, and page 2 would just be an internal document. So here's what your form is going to look like once it's completed in the printed view. You can see the patient information. Any information that I would have keyed in would obviously be printing on this form. And so it's a pretty similar rendition of the current form. It can automatically bring in the electronic signature of the provider. And of course, if you have a tablet, your patient, we could create it where your patient could sign right on the line without having to physically print this to paper. One other thing I want to note, it will tell you what date it was printed and how many pages total. That's system driven. I believe a future version will allow you to determine whether or not you want to have that. So here is the printed view. I can't edit on this printed view. I could go back if I said, oh no, that's not what I needed, or I forgot to fill in information here. I can simply close out of this, come completely out, go right back into my patient chart, and here's my form, and I can just go back into edit mode, and I could make additional edits to the form by coming here and putting my information, etc. I'm going to go ahead and create a printed view for you of this form, and this will be, and I'm going to once again batch this document so I'll know which one it is. Go back to my desktop. So the charts just lets me view a patient chart, where my desktop is the portion of the system that organizes all my tasks, any prescriptions, and you can see the counters here of encounters that I have to deal with, attachments for my approval, etc. So a quick and easy workflow.